lack of education, poor health, face difficulty accessing mental health services. They're at greater risk for violence and substance abuse. The very formation of the task force and the scholarship recognize these needs by supporting Latino social workers in pursuit of the LSW degrees to address these problems. So I really want to say that it really does become critically important that designated advocacy efforts towards continued sustainability of the Latino Social Work Scholarship are supported to both recruit and retain Latinos interested in pursuing their MSW degrees. Secondly, the scholarship is addressing the need to have Latino social workers who are also linguistically able to provide services to the community. There is something to be said of Spanish-speaking social workers who would only have greater opportunities to permeate cultural barriers that otherwise might exist. How can Spanish-speaking social workers achieve this? Well, we're having a very large influx of Latino immigrants. For example, I haven't been exposed to the social work practice. And by speaking the same Spanish language, social workers can outreach and share how our profession can help the Latino community. Another way Spanish-speaking social workers impact our community are by sharing how interventions can aid in adapting to new culture. That stress of acculturation brings. So therefore, Spanish language social workers would be great advocates for services, referrals, to provide necessary interventions, and be key stakeholders in the development of programs to address the needs of the Latino community. The conversation on the shortage of Latino social workers can exist without mentioning leadership and mentorship. And the task force itself serves as a vehicle to combat what I feel is a sense of isolation within our social work profession. It's creating networks and supporting Latino social workers who will be leaders in our profession. Latino youth are not filling the seats in high schools or colleges, let alone master's degree programs. I can speak for myself as a student at NYU that while I was immensely supported by my peers and academic staff, I was among a minority. I'm even a minority in my own family. I'm the first to attend college, and I'm the first to receive a master's degree. So as I said before, the social workers, we're going to be able to change the stakeholders when it comes to developing public policies, then we're going to directly impact the Latino community. It becomes of paramount relevance that we support social workers who are going to represent us. And I'd like to switch gears a little bit. I ended my comments with a few words on our aging Latino population. That is my passion. That is what I received my social work degree in, to concentrate in the field of aging. Some of you may have similar experiences. Family was a major factor that influenced my career path. My grandparents, mi abuelos, have and continue to be an influencing factor in my life. So as our Latino population is growing, we're also aging. And just to give you a couple statistics, in the year 2008, the Latino older population was 2.7 million, and it's projected to grow over 17 million by the year 2050. By 2050, the percentage of older Latinos is projected to account for 19.8% of our population. And in just 8 years, in the year 2019, the Latino population, for 65 and older, is projected to be the largest ethnic and racial minority group. As an example, there are disparities among our Latino youth, but there are also disparities among older Latinos. And let's talk about education. In 2008, about 46% of Latino population aged 65 and older had finished high school, compared with just 77% of the total older population. In 2008, 9% of Hispanic older Americans held a bachelor's degree or higher, compared with 21% of all older persons. So you can find these statistics and more. The Administration on Aging is a great resource, and I share that with all of those students here. So just as we're facing a shortage of Latino social workers, we're also facing a shortage of Latino social workers who are trained to deal with the complexities of an aging population. They're going to need access to social and mental health services, and we're not prepared for that. So I do encourage schools of social work, while they increase our mentorship and leadership among Latino social workers, to also address this segment of our population. There isn't enough attention to health and policy reform, and we need to support and encourage our Latino youth seeking employment in agencies servicing older adults. Thank you.
When you're talking about legislation, gracias, caballero. My name, can you hear me? Yeah.
My name's Rosa. I don't know. Yes, I saw. I know.
Good afternoon. I have a quick question, comment at the same time. I think any one of you probably maybe more interested in this one. You know, one of the issues with policy and the connection between policy and legislation. If you don't have in the legislation something that says to do something, normally you're not going to get it out of policy. It's not going to happen when you go into policy and put it into the agency. If the legislature doesn't make a comment about it. Years ago, I think it was Bush 1. There was a conflict in, I think it was in Nicaragua or somewhere in Central America. And there was a bill that passed through Congress that actually had $200 million for Head Start. I remember reading the bill and saying, what does Head Start have to do with Panama? Well, some legislator basically said, you want my vote, it's got to be there. That's an area that we need to work on. It's got to be in the legislation. It's not in legislation. You can battle the policy where you want, but it's not going to happen.
Yeah, that makes a lot of sense. The question is not that so much as the process by which that happens. And again, getting back to the advocacy capacity within the Latino community, the issue is how we organize to put pressure on legislative bodies to do exactly that. And one of the things that we have a problem with, right, is quite frankly, I think, and here in New York especially, people would say that we have a crisis in political leadership. Latino elected officials are just not being effective enough in terms of doing that kind of work on behalf of the community. I mean, it's something that every place I go, you know, I'll say something like, políticos latinos son un chorro de pillo, and everybody can just stand in ovation. It's like an easy thing to say, and that's such a general feeling. So the whole issue of things like we talked about, the vehicle of Somos El Futuro becoming more effective in terms of doing that kind of thing and organizing people around that is a challenge. It's something that needs to be done, but it's a challenge that it's a barrier at this point. And the idea of how do we get organized to work with our elected officials and make them more accountable is something that we really don't do. What happens now is a lot of our social agencies that have become the advocates by default because, you know, our elected officials are just not doing the kind of job we need them to do, have become very extensions of the government, right? They basically depend on government funding. And that keeps you from doing the kind of advocacy that you need to do sometimes because you're worried about the fact that your funding might be cut. I saw that, you know, when they cut the member items this past year, a lot of the organizations were dying in terms of, they talked about the discretionary funding. And they were going to elected officials for help. And, you know, there were no help. What happens when, you know, we have a growing number of Latino elected officials in the assembly and the city council, but the problem is what happens when they can't be effective in terms of putting pressure on the governor or the mayor. And, you know, when I go talk to the governor, the mayor, people, and ask them, do you have Latinos that come to you to advocate on issues? They go, no. Usually when Latinos come to advocate for something, they either they want a grant or they have a resume, they want to give somebody a job. We don't have anybody raising the kinds of issues that we're talking about here. Well, that's what I usually get as a reaction.
You know, they might tell you that, it's that they don't, I have to say, there's certain times that's okay, but I would say as a whole, I think what happens is that it's true that it should be, I don't want to take more time, but what the problem is that there are agencies that advocate in terms of its discretionary, everybody was advocating, and everybody was not listened to. And therefore, we had Hispanics, we had, there's a lot of advocacy. And when things like, for example, one of the advocates, and I just want to mention mental health redesign, what's happening with the mental health clinics right now. Our communities need it more and more. And yet, when you look, a lot of clinics are going out of business because of the managed care. And so there are a lot of issues we could advocate. But working together as a group, we should continue. And I don't want to take any more time. I'm sorry.
Yes, hi. Good afternoon. My name is Rosa Bradley. I'm the director of Frontera de Esperanza, Borders of Hope in Jackson Heights, Queens, under the Diversity Center of Queens Pride House. And I just wanted to address a number of issues that I've heard throughout the morning. And I hope that this is not a conference where we're pretty much saying the same thing. I think some of the presenters addressed the issue of action, and I would like for that to take place. I think it's been a wonderful conference. I think that as immigrants, we have a pool of immigrants who are coming in from all over the Americas who are already professionals in our field. We do have psychologists, we do have social workers who have been trained overseas. And I know that for a while, different organizations, the Association of Hispanic Mental Health Professionals, and I know Dr. Hendricks and others have been interested in continuing that. And I think that we, when we're looking at policy and advocacy, we need to also address how we can, as a profession, facilitate the process where they can get licensing so that they can work in the communities. We already have the professionals that we need. Also, working in Jackson Heights, Queens, we work primarily with Latin American, Central South American population, where there is a lot of grassroots organizations that are taking place. That when Mr. Angelo, when you mentioned that there's not enough organizing, I think that what needs to happen are the tools. I think groups are already happening, but what are the tools? How can we, as a profession and as advocates, provide the tools so that these organizations and groups can come together? I work with the Latinos who work at Ground Zero, the cleanup workers, and these are individuals that no one has really advocated for. And they have come together, they come into churches, another part of our program, and they knocked on my door. They said, we need the tools. And so that's what we're doing. So I hope that this conference will bring us to a place of action. Thank you.
One of the recommendations that was made by the roundtable was about exploring alternative licensing for exploring trained professionals. I happened to chair the alliance and had a private meeting with Dr. Mary Wakefield, who's the administrator of HRSA at the federal level, who's responsible for a lot of the health and workforce transformation efforts that are going on in the country now, and Pamela Hyde, who's the SAMHSA administrator, and both of them said, yeah, they would love to see a unified licensing or alternative route, but they said they don't ever see that ever happening. One, it makes too much money for licensing boards across the states for them to ever give up that privilege of licensing professionals. So, and it does. I was the vice chairman of the licensing board in New Jersey, and they make over $2 million in fees. They're not giving up that practice, but we do have to explore what we can do for foreign trained. Unfortunately, I've gone to the APA head, to the head of some other behavioral health professional groups, and their membership will not support that because they say, we have $100,000 in student loans, or we did, our postdoc fellows, we did this, and who are they to come here and now get a free ride? So even the ones you think will support it, will not support it. Because I've met with the president of the APA, who happens to be Latina now, Mo Vasquez, and the membership will not support, unfortunately, support alternative right.
Thank you. Next week, I guess.
Hi, my name is Samantha Ramirez. I'm actually a student at Indian College in the PSW program. I was listening before and you were saying that us as Hispanics, we tend to hold, our elderly very dear to us. And I know a lot of elderly choose to stay home as opposed to going to rehab facilities or nursing homes. I've worked before with visiting doctors programs. My question is do you think if more emphasis was paid to these visiting doctors programs, it would actually benefit the community in general? Only because it would limit the inpatient rates and everything else. So you're saving money and also the patients would have more accessibility.
I'll just say a bit about that. Yeah, I think that if the funding was there, it would be great to provide more resources for these sort of home visiting physician programs. Our older population is unable to leave the home at times. They don't have escorts. They don't have a way to get to doctors. And if there's an initiative in New York City, talking about age-friendly initiatives where we're trying to create an environment to support our older population. So I agree with you. If there was the funding, those programs really would benefit to serve that population and to be independent within their communities.
I would add in a different way, the population, what's happening is that our programs, I agree with you in terms that if there were more resources, and I know that there are physicians, there are groups that are going around to the homes. But the other aspect of the of funding, what's happening to all our agencies, and we have lost a lot of agencies, when you look at the funding situation, within just the aging, let's take aging, we took the ACS, we did foster care. Consolidation has been funding. Consolidation means that there aren't many of our agencies. There's less funding for some of our agencies, and there's a lot of our agencies don't have the infrastructure. I think one level that should be put within the action agenda and the advocacy is really as our infrastructure is compromised, the ground is shaking, constantly moving, and this jeopardizes our existence. And that's Henderson Torres gave it to me because we were talking about, and what's happening is in consolidation, for example, from 92 program, you have 20. And if you get one Hispanic agency, that's a lot. And that goes through ACB, through all, it's now happening in all that. Regionalism means always is less, and therefore our senior services, with the population growing that quickly, they are not able to provide all the services, even though they could. Age-friendly is fine, but our agencies were around before age-friendly, providing those bilingual services, the one-to-one, the counseling, and we need to help our agencies build their infrastructure, because that's the only way that we're going to be surviving, serving our community. Next question.
Again, my name is Dennis Camacho, I'm very active in the community. Also, I'm part of Ivy Park Community Development Corporation, which has a shelter, and at times has been great in funding the program. I also work with the A Center of Prince County, which is with the mental health program, under the Leaders Exchange program, under the harm reduction model. And I also facilitate a transgender group, which they have a lot of concerns about the services in the city about concerning who are non-HIV positive. A lot of times they have complained that there's no services in terms of mental health, in terms of social workers, unless they're HIV positive, and also in terms of receiving health medical services, Medicaid basically. My concern is that what is that we can do in order to help most of the folks who are not HIV positive? Because the message is that in order for you to get services, you have to be HIV positive, which I understand there's a lot of needs and a lot of services for them. But the people who are at risk and they're out there in the street, they need services also. They also need legal services, because most of our community is being bullied not only by the police, but by the justice system. So I have a lot of concerns because when it comes down to referring people for services, there's none or very little that we can do in terms of giving them services. What this panel can do is represent that kind of population.
I'm not sure I understand your question.
My question is that the people who are not HIV positive are not getting the same services who are HIV positive. How can we help them get the services?
Well, I think, basically, there's not enough mental health services that to meet the needs.
But it's not talking about mental health services.
But mental health service, yes.
For the
Oh.
community.
Oh, I see. Well, I guess we should put that as a list on that.
Right, so we're talking about mental health services.
Okay, so we could bring it,
The services is really for the
Right.
LGBT and trans community.
Unless they're HIV positive, they can be referred for
I
somebody.
understand, so.
But they're not HIV positive, so they're at risk.
So,
You know, one of the things that we need to understand is that when we're talking about these specific programs and issues and these gaps, that there's a war going on in this country in terms of the role of government, right? The role of what's happening with the social safety net. Right now, there's a major battle going on in Washington over that, to the point where, you know, there's those kinds of issues that we need to also weigh in on in terms of the kind of resources that need to be put into these kinds of programs. We're in New York City, so as many gaps as we have to be thankful that, you know, there have been many struggles here to get many services here that don't exist in other places in this country. Pero, right now, there is that war going on that we need to be a part of. So when you see those guys in Occupy Wall Street, and they're talking, you know, about the role of government and the role of Wall Street, when you see the Tea Party attacking the role of government, those are issues that should be central in our community, that we should be talking about. Because we can be talking about very specific services. Meanwhile, there's a bigger discussion going on that affects that very specific issue, those issues that we're talking about. And if we're not involved in those bigger issues as a community, we're going to lose a lot. And right now, sometimes, you know, as we get focused and get very specific on things, sometimes we lose the bigger picture. We need to be a part of that bigger picture.
thank you.
Buenas tardes. Blanca Ramirez from Mercy Center in the Bronx. And in the Bronx, we don't know when we're going to hear about the next scandal of which political figure is going to get indicted. So when we talk about effective political leadership, you know, there's a question about whether it exists or not, and who's accountable to who. And for that reason, I want to bring up part of social work that, you know, we throw aside, and that's not part, which is community organizing. And the fact that we need more people who are trained and who are already trained to work on it. And we already have organizations in our community. Mothers on the Move, Make the Road by Walking, Community Voices Heard. And there's, you mentioned Occupy Wall Street. There's a group who's meeting on Fordham Road every Saturday, 11 o'clock, walking across Fordham Road with their signs to join the folks down at Wall Street. We need to connect our institutions. You know, we have professional social workers, we do all of this and that, but we need to connect with the grassroots organizations that are already making a difference and are holding those accountable so we can get the right things in our neighborhood. We have some of the organizations and some of the people there already. How can we pool our resources to make partnerships so we can both be more effective in terms of not only professional leadership, but the grassroots leadership? We had a parent PA president here. How can we get more of those so that we can work together and do those things?
Okay. I will take that into consideration, but I will say that there are a lot of grassroots. We have a very strong Hispanic Senior Advocate Council. There's a membership of over 6,000 people and a participatory rate of 100,000. And all of us and Raices and all of different groups of the aging get together, and as well as in terms of fighting for the youth. And I think it's very important, and we should do more of it. And I think that's what's the purpose of this here, is to get the social workers as well as people in the field and caseworkers, to really understand what is the impact policy on your services and on your work. Because if you don't get the money, it's going to go down further. Yes, sir. I think that's the last one.
Can these issues be brought up at the town hall? The town hall, yeah, the town hall.
I'm sorry, the town hall.
Just as a follow-up to the individual raising the question regarding medical home, you can speak with me afterwards, but there is an integration of the medical home and the health home. If you go on New York City, on the Department of Health website, you would see that. You will also see that there are several Latino physicians that have just recently received the designation of a level 3 medical home model, and I have that information. Medicare pays for the home visits. They're lobbying to see if Medicaid would be able to take on the service, but more to follow.
Okay, thank you. No, I can't have any more because another panel is ready. I'm sorry, but there is a town hall right after this. So you could really bring up your issues. Thank you. Thank the panel. Let's give them a round of applause.
Thank you very much, Selena, for leading this panel. It's a fabulous panel. We are continuing to be right on time. Earlier, I asked our planning committee to stand up, and I wasn't clear, and everybody stood up. At this point, just to be able to stretch your legs, why doesn't everybody just stand up, take a stretch, before we move on to the next panel? But don't leave. These panels have been very relevant, very on target, and the next panel is going to be very significant for this conference. Okay, we're going to get started. I want to ask our education panel members to come up. So you can have your seats again. Thank you. I want to ask our education leaders on the panel, please come up.